Welcome to this week's NIB News Update.
While much attention has been given to private sector participation in the National Prescription Drug Plan, the public pharmacies also play an important role. Philandra Bain, pharmacist at the Princess Margaret Hospital, explains.
Well, initially when we had the launch of the drug plan, we saw an influx. Persons were coming in. Right now, we average about 50 prescriptions, maybe about a week, give or take. Like that number can change on a daily basis, but give or take 50 prescriptions. Some of the fast movers, things like your Codivan, your Diavan, the aspirin, Adalat, your insulins like the Novolin 7030, Dimicron, and the lisinopril. So mostly a lot of the hypertensive medications and the diabetic medications, those would be some of the fast movers. We're mostly seeing prescriptions coming in for senior citizens. On occasion, we would have prescriptions coming in for children, and it would be for like the asthma medications, your Ventolin inhalers, and your prednisone syrup. I guess the only time we get any comments is when they find out the medication that the doctor recommended is not one of the medications that are covered by the plan. So that's the only time we really would get any type of comments from the customers. In a situation like that, we would try to accommodate them on PMH side. Because here at PMH, we have the plan as well as our own stock. So if it is the plan doesn't cover the medication and we have it as a part of our stock at PMH, we would accommodate them from that stock.
According to Ms. Bain, there are some protocols beneficiaries must observe when using their ACE cards at the PMH pharmacy.
It's important, first of all, that patients have to be present. In other words, if I am the daughter of, say, an elderly person that's bedridden, a lot of persons are not aware that they have to fill out a special form from NIB, or they would have to have a letter typed up with the person's signature to the bottom saying that they give permission to the bearer of this note to get the medication on their behalf. NIB has specifically instructed us to do that, and a lot of persons, they're not aware of that. So that's one thing I want to let people know. They must make sure that if they are not the person receiving the medication, they either have to have that form filled out by that person or a letter stating that they have permission to get the medication on their behalf. Secondly, a lot of persons, they don't remember who they saw, the doctor's name. They don't remember which doctor, I guess, signed the form for them. And so that's another thing we need to let the patients know. They have to know the doctor's name in order for them to get the medication from the plan, because that's one of the first fields that we have to fill out when we go into the NIB system. The name should be written on the prescription, and the doctor should have a stamp. All doctors are given stamps. So if it is they have, these fancy signatures, they should at least try to print their name legibly so we can understand, or use their stamp so that it's clear. Anywhere the patient goes, they would know that this is the doctor that they saw, or this is the doctor's name that we're putting in the NIB system.
At the Fleming Street Clinic in Grantstown, approximately 30 drug plan prescriptions have been filled since the launch of the plan. Meanwhile, at South Beach Clinic, pharmacist Londa Taylor offers this advice.
Persons coming for the first time with their cards. A lot of them, they don't have any refills. So we recommend that they go and they see the doctor so that they can have a new prescription. Then we can assess their medications via the drug plan.
For more information on the National Prescription Drug Plan, visit nibdrugplan.com or call 356-2070.